Today's literal question reads, jowls, but why? Why do jowls happen? There's a few different factors at play. One of them is genetic. If you look around at other people in your family, men and women, you may notice that some families tend to have a genetic tendency to have a heavier lower third of the face, and that includes some jowling around the mouth. The other reason it happens is because our fat pads, as we age, naturally start, due to gravity, sliding down the face. We see that under the eyes, where our fat pads that were once high and tight under the lash line start moving down, and you may notice some malar mounding and just some fullness kind of at the top of the cheek, combined with some howling and the under eyes. We see it as the cheeks slip down into the lower third of the face, and then finally in the jowling area. The great news is we can fix them. How do we fix them? With Morpheus 8, I use a special technique focusing not only on the actual fat pad that's falling off the face. This is a great example of when fat melting is a beautiful thing and it makes a ton of sense. No one wants to preserve their jowls. That has never been said to me in the history of the world. If you know somebody that wants to preserve their jowls, I would love to talk to them because that's very interesting. But no one wants to preserve their jowls. It's a great example of where Morpheus's fat melting capabilities are a super power, a super strength, and something that you definitely want to do. The other thing that I like to do is really reinforce the skin around the jawline. If you have some heaviness in the lower third of your face and that starts pulling down and the skin underneath the jawline is not strong and it cannot support it, that's when you see kind of the pouching and the dimension that it gets, especially on the profile. So jowls, but why? The answer is gravity and probably a little bit of genetics. And the great news is I can help you fix them.